Our project is about a comparative study on atrial fibrillation ECG with the normal limits using signal processing. Our batch members are H. Mohammed Misal, P. Raghunath, and M. Thomas Benjamin. We have been guided by Mr. Satish Kumar, Assistant Professor, Department of Biomedical Engineering, Well-Tech Multitech, Dr. Rangarajan, Dr. Sakuntra Engineering College. Okay, moving on to the project. Our aim of our project is to analyze the atrial fibrillation ECG with the normal limits using signal processing. And the objective is to acquire the normal ECG signals from the normal patients with the modified limb system and to acquire the abnormal ECG signals from the patients using the same MRL system, and to compare the beta interval of the atrial fibrillation ECG with the normal limits and to create a database for the clinical diagnosis. Then the abstract. In India, 0.6% of males and 0.4% of females are affected by the atrial fibrillation, where 14% people are under 50 years and 15% are above 50 years. The atrial fibrillation is an unevenness in the atrial signals which causes the defects in the heart. It may lead to strokes and atrial fibrillation. To detect the atrial fibrillation, the atrial deposition wave should be analyzed. That is the beta signal in the ECG. So for this, a simple PC-based signal processing approach has been used with the help of MATLAB toolkits. So then the database will be created for the time periods of the beta interval for the clinical diagnosis of the atrial fibrillation condition. Literature survey. We have been referred the following papers for the reference. Workflow. The workflow will be on obtaining the normal ECG signal, then the beta interval will be analyzed for the normal ECG, and then acquisition of normal ECG signal, then comparison and analysis of normal limits, and then creating the database. Methodology. The acquisition of normal ECG samples from the two different age groups. First, 5 male samples of age group 20 and 9 male samples of age group 52 are being chosen. The signals are acquired using normal limb system, modified limb system. Initially, a Butterworth bandpass filter will be used to separate the ECG signals from the other noises and interferences. Then windowing technique will be used to separate the beta interval, and then averaging will be done for the average signals. So initially, the signal is to be converted to frequency domain by using FFT algorithm. So rectangular window approach is being used for separate the beta interval from the normal limits. Then signal averaging will be used to analyze the beta interval. The same flow will be used for the abnormal ECGs. So this is the raw ECG signal which is being acquired from the patients. This is the bandpass filtered ECG signal. Then this is the windowed beta interval. The result will be on like beta interval time duration which has been 0.2160 milliseconds. This is the created database for the age group of 20 with the normal time duration and the amplitude for P and beta wave. This is the mean values of the 5 male subjects of age 21 with these standard deviations. Let me zoom it up. This is the amplitude and time duration of 9 male samples of age 52 of P and beta wave. This is their mean value. Inference. Based on the above table, we can infer that beta interval for the age of 20 was about 135 with a standard deviation of 23 milliseconds, and for the age group of 52 it was 142 with a standard deviation of 28 milliseconds. We can clearly see from the table that normal beta interval decreased for the abdominal conditions, and also the RR interval is also decreased, showing the increase in heart rate. So result will be like creating a database for the normal and abnormal conditions. The created database will be used for the clinical diagnosis.